In tonight's follow-up, you may recall a few days ago, I told you I needed to get a biopsy to determine if what was discovered in my recent prostate exam was cancerous. I have 2 risk factors, so early detection is critical. Well, I now have the results.
This part is the part that we can't completely numb up for you. Feels like someone big fat finger going in there.
In order to get the results, this had to happen first, a biopsy involving what's called a trans-rectal ultrasound.
And now we're gonna just take some pictures of the prostate. We're gonna inject a numbing medicine in there.
This all follows something discovered a few weeks ago by my doctor, John Liu of Urology of Virginia. Now, it wasn't from my PSA blood test, which helps detect prostate cancer. For my age group, my score was normal. But Dr. Liu did notice something when he did a physical exam of my prostate, leading to this.
Can you see the area that you're concerned about?
No, I haven't been able to see it clearly on the ultrasound.
Does that tell you anything?
Well, about a third of prostate cancer will show up on ultrasound as a darkened area. But the majority of prostate cancer you don't see very clearly on ultrasound.
We'll eventually know for sure by taking some samples.
I have real-time picture the entire time, so the picture allows me to know exactly where the needle's going to. The clicking sound is just the needle gun firing. So first click, hold still.
Okay.
Each click sound is a little firing of the needle and getting a little sliver of that prostate.
A couple of reasons the doctor said we should have this biopsy. I'm an African-American male, and there's a disproportionate rate of African-American men getting prostate cancer. And I have a family history. My father was treated for prostate cancer.
According to the National Institutes of Health, African-American men have a 60% higher rate of getting prostate cancer than white men. That's the highest rate for it in the U.S. Researchers say there are a number of possible reasons, but topping the list,
I think it's still probably most likely genetic component.
All right, so if you look closely on that surgical glove is a little sliver taken from my prostate. 13 of these from different areas of my prostate will now be analyzed for cancer. All right, it's been a few days. I'm back to see Dr. Liu to talk about the results.
Well, Kurt, unfortunately, we did find, a few areas of prostate cancer.
But I have cancer in my body right now.
Yes, you do, yeah. And there's a couple of areas on the biopsy that was intermediate grade, and there's one high grade prostate cancer. So we do recommend, for someone as young as you are to go ahead and move forward and consider treatment to get rid of the cancer.
There were 13 samples. 4 showed some type of cancer.
Right.
But 1 or 2 showed a more aggressive cancer?
Right.
Is there any way of knowing now whether it has been confined to the prostate?
No way to know with absolute certainty based on your PSA being relatively low. The risk of extraprostatic or metastatic disease is very low, but we are going to get some imaging studies. We'll usually start by doing a CAT scan of your abdomen and pelvis, where we'll get a good look at all the lymph nodes.
Once doctors know for sure that it hasn't spread outside the prostate, then I can consider my treatment options. One involves using a surgical robot to remove the prostate.
And then also radiation is also an equally effective way of treating the prostate cancer. There's different ways of doing the radiation. You can have what's called brachytherapy, which is putting in radioactive pellets into the prostate and delivers radiation directly into the prostate.
There's also Hampton University's Proton Therapy Center, which delivers a very focused beam of radiation to the targeted area, my prostate. In the days to come, I'll be having consultations to weigh all my options. What should my case tell men that are watching this story? My PSA was not only in the normal range, but my last one was down lower from the previous one.
Right.
And it was the digital rectal exam that caught it.
Right, exactly. There are some small portion of patients that have a completely normal PSA, and the cancer is picked up simply due to just an abnormal digital rectal examination, which was in your case.
We wouldn't have caught this without the digital rectal exam.
Right, if we went but just by PSA alone, we would have potentially sat on this much longer than we should have.
Think about that.
My goodness.
If not for that physical exam of my prostate, and It's the digital rectal exam. I've been talking to some people and they hear digital and they think there's some kind of technology involved. There's no technology. It is what I call Dr. Jellyfinger. I'm not trying to be crass, but that's what old school. That's what gave them some warning that I needed to have this biopsy. And so, men, if you're only getting the PSA, and I'm just going to tell you, sometimes doctors will give you the option. If your PSA is normal, they'll be like, well, do you want the physical exam? No. Well, what I'm saying is yes. Especially if you have the risk factors, you do not want to pass on the digital rectal exam.
And first of all, Kurt, we are so grateful to you for sharing your story. Everywhere I've gone, people have been giving well wishes, prayers. Kurt, you've got this.
And can I think, I am overwhelmed by all of the support that I'm getting from my church. They were asking me online, people emailing the newsroom. Thank you. I mean, I really feel the love from prayers and well wishes. So thanks for that.
Well, because we love you, Kurt.
Yeah.
We
all right.
love you.
So here's the deal. If you go to WTKR.com, you will find a web extra. It's like a kind of the full conversation, some of the stuff that we had to leave out with my doctor. And then tomorrow at 12:30, we're doing a Facebook Live. I'm gonna take all your questions. And the ones that I can answer, I will, just about the whole experience. But so that's tomorrow at 12:30, Facebook Live. But check out the conversation with my doctor.
This uncomfortable exam that most men would rather avoid.
It's the reason that I now know I have cancer in my body.
My goodness. Thank you for sharing with
Yeah.
us, Kurt. Thank you.